What are allergies? An allergy is an exaggerated reaction by the immune system in response to exposure to certain foreign substances. These foreign substances are normally seen as harmless by the immune system in non-allergic individuals, but in allergic individuals, part of the immune system generates a response. When an allergic individual comes in contact with an allergen, the immune system mounts a response through an antibody called Immunoglobulin E, IgE. People prone to allergies are said to be allergic or atopic. Allergy-producing substances are called allergens. Examples of allergens include pollens, dust, mites, molds, animal proteins, foods, medications. Allergens may be inhaled, ingested, eaten, or swallowed, applied to the skin, or injected into the body either as medication or inadvertently by an insect sting. The symptoms and conditions that result depend largely on the route of entry and the type of allergen. The chemical structure of allergens affects the route of exposure. Airborne pollens, for example, tend to have little effect on the skin. They are easily inhaled and will thus cause more nasal and respiratory symptoms with limited skin symptoms. When allergens are swallowed or injected, they may travel to other parts of the body and provoke symptoms that are remote from their point of entry. For example, allergens in foods may prompt the release of mediators in the skin and cause hives. The specific protein structure is what determines the allergen's characteristics. For example, cat protein, FeL-D1, from the Felis domesticus, the domesticated cat, is the predominant cat allergen. Each allergen has a unique protein structure, leading to its allergic characteristics. In the air, aside from oxygen, the air contains a wide variety of particles, including allergens. The usual conditions that result from airborne allergens are hay fever, asthma, and conjunctivitis. The following allergens can trigger allergic reactions when inhaled by sensitized individuals: pollens from trees, grasses, and/or weeds; dust mites, animal proteins including dander, skin, and/or urine; mold spores, insect parts, especially cockroaches; foods and medications. Foods and medications are the two most common allergens that are ingested, and they can cause allergic reactions, some of which can be severe. These reactions often start with localized tingling or itching, and then may lead to a rash or additional symptoms, such as swelling, nausea, vomiting, diarrhea, or difficulty breathing. Foods: the most common food allergens are cow's milk, eggs, peanuts, tree nuts, wheat, soy, shellfish, finned fish, and sesame. Cow's milk, egg, wheat, and soy allergies are most common in children and are often outgrown over time. The most common allergens in adults are peanuts, tree nuts, and shellfish. Gluten is not a common food allergy, and true gluten hypersensitivity, or celiac disease, is mediated by another type of antibody, not IgE but IgA, and also leads to different symptoms, including chronic abdominal discomfort, nausea, vomiting, change in stool, and anemia. Medications. Although any medication can cause an allergic reaction, common examples include antibiotics such as penicillin, anti-inflammatory drugs such as aspirin and ibuprofen, Advil, Motrin, sulfa drugs, seizure medications, insulin, especially animal sources of insulin, substances containing iodine, such as X-ray contrast dyes injections. The most severe reactions often occur when allergens are injected into the body and gain direct access to the bloodstream. This intravenous access carries the increased risk of a systemic reaction, such as anaphylaxis. Commonly injected allergens that can cause severe allergic reactions include insect venom, medications, allergy shots. What are the most common types of allergies?